we are interrupting regular programming for a special word from the congressman who represents the majority of our listening area, Dr. Mark Green. Good afternoon, sir. How's life in D.C.?
Yeah, thanks for having me on the show. It's busy right now. I'm actually back in the district though now. Trying to make sure hospitals are staffed with the appropriate equipment and testing and all that stuff.
There's a lot of focus on COVID-19. You look at the state of the stock market, lots of concerns with the economy, and for some reason panic buying of toilet paper. For those folks, and with your vast medical background, what can you tell your constituents to hopefully alleviate some of this pressure, some of this worry that's overtaking folks in the area?
Well, I think it's really important for everybody to understand what we're dealing with. We're dealing with a vaccine or a virus that it has a higher mortality than the flu does during the standard years. When the flu is pandemic, meaning it has mutated so much that the immunity that's there, the base herd immunity, is inadequate. Then they're very similar. But right now, this is a pandemic new virus with no immunity, so the mortality is pretty high. I mean, it's 15% if you're over 80 years old. So we do need to be very cautious. We need to be particularly cautious with the elderly, nursing homes, visiting people in the hospital, because that's where the sick people are going to go. So if you're well, you want to stay away. And if you have symptoms and they're not severe, you want to stay away, particularly from the emergency department. But it's a virus that has those symptoms very similar to flu, runny nose, sore throat, although those are less in COVID-19 than they are with flu. Cough, shortness of breath, chest pain are much more severe with COVID-19. And very interestingly, patients tend to have a very high fever with COVID-19. So it's we all got to be on the watch for illness. We all got to kind of do the social distancing, and we'll be okay. If we adhere to the social distancing, we wash our hands and do the precautions that are necessary, we're all going to be okay.
Congressman, there's a lot of information that's flying around online and just in daily conversation with folks in the area, and some of that is a level of misinformation. There's talk now, I believe, of martial law implementation in some conversation I've heard. There's calls to the president to shut down the country for as long as 30 days or more. And with some of the things that you've seen in D.C., can you set the record straight on any of this?
Yeah, so on Monday, they actually traced it to a source outside the country that, and I actually don't, all I know is I was told it was a source outside the country that started the rumor, essentially, that we were going to do a martial law thing. And that there's nothing further from the truth. There's no plans that I've been told that we're going to be mandating people stay at home or anything like that. Now, they're asking people to stay at home and, not to go to work if you don't have to. If you can telecommute. And if you've got to go to work, stay 6 feet apart from your colleague and make sure you're using hand sanitizer. All those things are requests. They're not, no one's implementing martial law. And that's just, unfortunately, in the world of the internet and social media, rumors like that can be spread. I know the other day somebody spread a rumor that Mark Green was resigning. I got a phone call from a news reporter. Hey, I heard you're resigning. I'm like, no. And then I realized that it was Mark Green, the guy that works at the State Department USAID office, government aid office, and he had made a big announcement he was resigning. So a lot of people, oh no, Mark Green's resigning. So that's the other Mark Green or a different Mark Green. So you just have to be very careful with what you see on social media, and you can always check our website. I mean, my website, my .gov website, or the CDC has great resources on this. We'll be updating my COVID-19 page tonight with some new data, and so we just, I would use those reliable sources for information. And people can always call our office for clarification.
Congressman, let me ask you, with your medical background, having served in the U.S. military for a number of years and then in private practice, how can we best defeat this thing?
Yeah, it's about flattening the curve, right? You've probably heard that expression. I know Dr. Fauci talks about it all the time, and he's on TV almost every day, multiple times a day. Really, you do that by decreasing the rate of spread. So this virus has what's called a very high R naught, and that is R with a sub-zero. That's a medical biostatistics term. And the number of people, what that equals is the number of people that one person will infect. So if the R naught is 10, then for every person who gets the disease, 10 other people will get the disease. Well, that's a very rapid spread, right? They think this one's around 3. They don't know. They're still doing a lot of data gathering, but that's pretty high, too. That means it's a self-perpetuating virus, and so we've got to do those precautions that I talked about earlier. We've got to do the social distancing if we really want to slow the rate of spread. And if we slow the rate of spread, we'll be able to prevent getting over that tipping point where we have about 160,000 ventilators in the country, not counting the DOD's stuff that they brought online today, not counting their strategic reserves. So if we say 160,000 ventilators, but we have 180,000 patients who need a ventilator, well, that's a tragic scenario where 20,000 people who need ventilators aren't going to get them. But if we delay the spread, that means that at any one point in time, we never get to the 160. Everybody who has a ventilator, a need for a ventilator, has a ventilator, and we never cross over the basic supply of our medical resources. So that's the whole point of delaying the spread, and you do that through social distancing.
How much worse do you think that this is going to get before we see the curve of this getting better, any?
It's really hard to say. We were very fortunate that the president, very early on, within 7 days of China making its announcement, they made their announcement December 30th, which wouldn't it have been great if they had made their announcement a little sooner, but they didn't. But they made it, and within 7 days, the CDC had formed its, operations center. Within 21 days or so, the president had restricted travel from China, and that has certainly helped us flatten the curve. But there's a lot still to do, and we're working hard to get testing out there. But again, an important point there is testing doesn't save a life. Testing lets us know how it's spreading and helps us to prevent its spread, but it doesn't save anybody's life.
At this moment, the Dow Jones Industrial is down 2,259 points. We're at levels now below President Trump taking office, and obviously over the past 3 years, it's been well communicated that stock markets were trading high, things were going well, and that's kind of been used as a barometer of the economy. In terms of this effect, the disease's effect to our economy, can you touch on that, and then also kind of go into some details on the stimulus packages that are one is currently working through the Senate, and the other the presidential administration is preparing to propose to Congress?
Yeah, so obviously, if the airline industry is shut down, the restaurant industry is shut down, Uber and Lyft are no longer generating revenue. Many other businesses can't necessarily perform because their supply chains are disrupted from China. People are at home, so they're not out spending money, and so demand side is down. It's going to have a massive impact. And a lot of the value of the stock market is based off, what the profitability of those companies are going to be. So if there's a huge hit to their profitability, obviously the value of the company is going to decrease, or at least, a stock is bought and sold just like used cars. So the increased demand, and you have an increase in price. Decrease in demand, you have a decrease in price, and so the overall stock market's down. I have a real suspicion that we get through this in 6 to 8 weeks, and then we're going to have a massive return, because Americans were in we were in an unprecedented, actually an historic place with the economy just prior to this virus. And what we have to do now is make sure that the supplemental actions that we take don't handicap the economy going forward after the virus, because there will be, if 80% only have mild disease, most of us are going to get through it and get on the other side, and then we're going to hopefully have an economy where we can have a job and feed ourselves. So we have to make sure these stimulus bills don't hurt our overall economy, and so that's where I'm trying my best to weigh in and make sure that small businesses aren't killed by the stimulus and the requirements, that they're fair, and that the government isn't picking the winners and losers, because when the government picks the winners and losers, that's when you get China and the Soviet Union, the old Soviet Union, and Cuba and Venezuela, right? So we have to develop a system to help these companies that are hurting, but do it in a way that's fair, and do it in a way that doesn't injure the economy or the country long term.
There's a lot of...
I'm
sorry.
No, I was just going to say that one of the biggest things that hurts the nation is debt to GDP ratio. I know people talk about nobody's interested in being a deficit hawk in Washington anymore. Well, I am. And so I'm very concerned that we wind up with an economy like Greece or, Spain. And so we have to just be very careful. I would much prefer the stimulus be loans as opposed to, maybe an interest-free loan, as opposed to the government picking who gets money.
Well, in terms of small business, and the radio station that you're talking on now is a locally owned small business, are there, what kind of safety nets are being put into place for companies like this with, fewer than 30 people or so? Or is it still too early to get a view on some of that as this is being laid out?
The Small Business Administration has just been funded with a lot of money from the president when the president made the declaration of a national emergency. So that very low to zero interest loans from the SBA for a company like yours. And I looked at some of the rules on that, and they're very relaxed. Honestly, you could go get one of these loans to actually grow your business. So you could build a new facility, and I think it's up to $5 million. So your smaller businesses that can help fund their cash flow, liquidity, can get that money from the SBA. They do have to show collateral for it. It's a loan, but the great thing about that is it's low to no interest, and I saw the payback was over 7 years with the option to renew. So that came out on Friday with the president's declaration of a national emergency.
Do you think Americans are going to get a paycheck over the next few weeks between, I think today I've heard the possibility of now 2 stimulus checks that's being discussed?
I'm not sure how effective that is. Putting that cash into the economy, I don't really think helped the economy back when it was 2008 and they did the stimulus, wrote everybody some checks. People did spend and they did save, and but basically the nation incurred more debt, and it didn't affect the long-term health of the economy. That's not what brought us out of recession. What brought us out of the recession was, Donald really got the economy going again was Donald Trump's cutting regulation and cutting taxes, particularly the corporate tax, because that allowed businesses to sustain that cash, that extra money for the long term, as opposed to a one-time, here's a check from the government. But do I think it's coming? That was really the question you asked, and it probably is. They seem right now there's a big competition between the parties as to who can outdo the other and look like they're coming to the rescue of the nation. And so that sentiment is up there, and unfortunately it's going to mean a lot of debt for the United States of America.
Let's talk about one more aspect of the effects of COVID-19, and that is the temporary to even long-term closure of schools. Here in this area, which we cover on the southern part of your district, spring break is scheduled for this week or next week, but a lot of these kids and parents and teachers alike, are now looking at an extended vacation of sorts. But this is not a vacation; it's a quarantine, and that's the overall goal. But when that comes back to the concerns of, well, okay, when they finally get back to school and federally and state mandated testing, that's a lot of anxiety on teachers, and there's a lot of concern from several colleagues. My wife is a counselor at the local high school, and several of her educator friends have expressed, similar concerns. I wonder how this is going to affect our job. What's going to happen with this? You have sent a letter to the Secretary of Education, Secretary DeVos, and asked for what kind of leniencies to be put in place because of the pandemic.
Yeah, so I got calls from teachers myself, and got calls from a friend of mine, J.C. Bowman, who I worked with when I was a state senator, and he said, hey, Mark, this is going to be an undue burden on the teachers. And so I immediately drafted a letter and had my staff, we forwarded it. I wanted to get it to her as quickly as possible, so we forwarded it Monday afternoon. And what it basically does is those ESSA requirements for absenteeism and the test administration, as a part of the federal funding at least, to waive those for a year. Now the states can choose to do that for their side too if they want, but at least on the federal side, we're going to try to get rid of those. What I'm doing right now is I'm asking people to call their congressman. Of course, you don't have to call me, but like if you're in the listening audience and you're in Scott Desjardins' district or David Kustoff's, or call those guys and say, hey, Mark's got a great letter, could you please sign on it? We'll get as many signatures on it, we'll resend it to DeVos Thursday, and then basically if she doesn't do it, then we'll draft a bill and get that bill passed to make it happen.
Fantastic. Any other notes that you want to add to your constituents before we go, in terms of maybe in a way, and there's a lot of folks who are exercising social distancing. Lots of churches have suspended services. A lot of other public activities, of course, are no longer happening as of right now. Can you close and speak to that, and in some way find a way to continue to support small business and local business in areas that have seen or have yet to see COVID-19 cases?
Yeah, I think if there was one last thing I would want to say is I just want to thank the people of Tennessee, because we've done such a good job. I called some hospital ER docs that are good friends of mine. I'm a former ER physician, and I basically said, okay, how's it going in the ER? Are you overwhelmed? And all of them said that the actual volume in the emergency department is down, which is really good, because what that means is people are not going to the ER unless they're really, really sick. And that's what we want, because if someone is mildly to moderately sick and they go to the emergency department, well, they're taking a bed up from somebody who might come in really sick. So Tennesseans are doing it right. I called a buddy in another state, and that state was, their ERs were overwhelmed. People were just coming in, I want to test. And, if you don't have symptoms, you don't need a test. So I really am very appreciative of our people. And of course, after the tornado, where we had 1,000+ people show up the next day at one site to help, and they couldn't even fit all the people that were volunteering. And I don't know about you guys, but that just, really got to me to know that the people of Tennessee are just such good-hearted folks, and right now it seems like we're putting each other's needs over our own, and we're really being servant-hearted, and I really am encouraged by that, and I want to continue to ask people to just continue to live that way, and we're going to get through this.
Fantastic. Congressman, thank you for your time. Always a pleasure to speak to you. You're welcome in the station anytime.
Well, thanks for having me on, and y'all have a great day.
All right. Thank you, sir.
Yes, sir. See you.
Already representing Tennessee 7th Congressional District, Dr. Mark Green, issuing an update from the federal government to area Tennesseans on the current status and relief efforts for the COVID-19 pandemic.